VS PharmTech is going to come up and tell us about their solution to a very difficult problem. So please, welcome to the stage.
Hello everyone, I'm Hoyeon from VS PharmTech. Big one. Okay. So we make better radiotherapy for solid tumor patients with medicine. I think many of you heard about the radiotherapy. As one of the 3 major cancer treatments, radiotherapy has been uptaken for 60% of cancer patients. The problem is that during the treatment, patients are exposed to quite high dose of radiation. For example, head and neck cancer patients receive 66 gray of radiation after the surgery for 6 weeks. It is about 1,300 times of dose limitation for nuclear energy workers for a year. It is quite huge amount of radiation, so many patients don't want to receive the radiotherapy. We believe making tumor cells more responsive to the radiotherapy could be a solution. Our technology, VS101, makes interrupts to repair the DNA damages caused by radiotherapy while preventing tumor cells getting resistant to the treatment. VS101 makes more efficient and safer radiotherapy with dual mechanism of actions and minimize the toxicity. Of course, it provides very conveniently for patients as an oral agent. When it comes to the market potential, it has great potential to be applied for solid tumors. There are a lot of evidence to believe VS101 is efficacious. This is our first human data for head and neck cancers. After 7 weeks of treatment of VS101, every patient received 100% of complete response in the tumor size reduction. It is really amazing result. We believe $80 billion of potential market is rising for solid tumors, but there are few players under development. We, VS PharmTech, is faster than the AstraZeneca in the development stage. We, VS PharmTech, is better than Johnson & Johnson in the safety and administration. When compared to the Merck in Germany, we believe VS101 is more likely to be efficacious thanks to the dual mechanism of actions. I'm very proud of my companies because they are experts in Korean pharmaceutical with the real drug development successfully. We secured 11 potential partners. To succeed in this market, we need $14 million to complete our clinical trials. Let's make a better radiotherapy together. Thank you.
Well, thank you for a clear presentation and also solving a huge challenge. Can I ask just the numbers, because you are right now in phase 2 and now you need the funding for phase 3, I guess. So what is usually the dropout rate? How many companies or innovations usually fail at this time, or what is the percentage to succeed?
Normally, in new drug development is a very challenging area. Only 5% assets succeed in the market. But our asset, our secret, is repurposing an existing drug. That means we can reduce the risk of the toxicity issues, and we increase the chance of the new drug approval. So we think we can faster our program and also increase the success rate.
Okay, thanks.
So thanks for that again, really great problem that you're solving. One question I would have is how does this compare to other, not competitors, but other alternatives to reduce this cancer? Follow-up question is, you showed one of your largest competitors is being discontinued, so that raised a number of questions for me. And then The other question slips me, but if you could go with those. please.
Yeah. So this is our market situation. So Merck Germany is already, actually they are in front of our company. They developed Geminapant, is known as an IAP inhibitor. Compared to the Merck, our asset is dual mechanism of action. Actually, we modulate IAP and also downregulate the DDR pathways. It means that we are more likely to be potent in terms of efficacy. So actually they dropped phase 3 because of the lack of efficacy. So compared to these old facts, we think we are better than the Geminapant in terms of efficacy.
And the IPRs are owned by your company? The intellectual property rights?
Yes, we have have IP to protect our asset as a method of IP.
Okay, because that, of course, that's where the money comes, right? So if you own the research and you go to market, there's a limited amount of time that you have before you have to allow generics to come into the marketplace.
Yeah, we have our strategy to protect our asset, including IP portfolios, and also we are orphan drug designation designated in the United States. So we secured 7 years of market exclusivity by the U.S. government.
Okay, magic answer.
Thank you for asking.
Thank you. Are you looking into expanding into Europe or the European markets?
So I expect that catches. So when it comes to the patient population, Europe is the biggest market in the world. But due to the limited our resources, currently we are doing only in the United States. But if we succeed, secure the investment here, we can expand our clinical trials to the multinational studies.
Great, that answers my question. Thank you so much.
Thank you.